C.A.R.E.
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 A non-profit creative and performing arts center in Charleston, Mississippi
presents the push against type 2 diabetes.
I'm Katie Toole.
I am Carissa Bradford.
I'm Jessica Herring.
I'm Meredith Basinger.
A group of 7 students came together
to research, write, and interview local residents
to learn about the causes and effects, the similarities and differences,
and possible solutions to the devastating disease
called diabetes.
Type 2 diabetes. What is it? Is it preventable? Is it manageable?
Much of it is linked to education.
They take their medication and they feel like the fact that they took the medication, they can eat whatever they want to eat.
We're ready to biggest our food. We're ready to corn, we're ready to bean, we're ready to pea.
Diet is just changed through the years. We used to have a lot more pure foods than we do today. And now we have a lot of processed foods that are chemically treated.
There could be a mandatory education, so that you have to complete these courses and you have to show some proficiency in it and show that you understand what the right food choices are.
Bake things instead of fry things, fresh things instead of, overcooked.
Kill a chicken for Sunday, have a chicken dinner on a Sunday. I had plenty of it.
I weighed like 279, I had hypertension, I had diabetes, all of that. Went on a diet, lost the first 50 pounds. I didn't have to take insulin. I didn't have to take blood pressure pills, anything like that. I'm a prime example.
If you can be diagnosed early, it is much better for your body.
Healthcare has been one of the biggest challenges confronting Americans for over 50 years. According to American Diabetes Association, more than 25 million Americans have diabetes.
They gain too much weight, they eat too much food, they eat what they want to eat, and what happens even when they're diagnosed with type 2 diabetes, many patients do not take their medications.
What do you think needs to be done in Tallahatchie County to help stop the spread of diabetes?
The education and sickness seem to follow one another, closely parallel one another, because the lack of information and lack of ability to assimilate that information seem to be the root causes of a lot of things.
How do we crawl out of this dungeon of death that is rapidly sucking the life out of our future generations?
We could create, some, one or more parks in the area that it could be walking tracks or just, a place where folks play, baseball or football or soccer or whatever your sport is.
We're going to do an environmental audit, look at the environment, things like sidewalks, crosswalks, safety, to get around actively. We also look at air quality, water quality.
How do we keep this monster of diabetes under control?
To establish good eating, healthy habits in an early age, trying to reduce fats.
In your opinion, which one is worse, type 2 or type 1 diabetes?
There are more people with type 2 diabetes that tend to die from complications of the type 2 or even have a great impact on their physical health from type 2, because by the time you get type 2 diabetes, you're older. You set in your life the way you're going to eat, what you're going to do.
Type 2 it's kind of a gradual, it can be either non-insulin dependent or insulin. Usually you start out as a non-insulin dependent diabetic, and if you maintain it, as you said, with diet and exercise and medication like your doctor gives you, then you don't have to end up on insulin.
And a lot of times patients get to the belief whatever's going to happen is going to happen, that they can't control it. And so they gain too much weight, they eat too much food, they eat what they want to eat, and what happens even when they're diagnosed with type 2 diabetes, many patients do not take their medications.
You just have to really be careful what you're eating and try to keep it up. I try not to let it go below 70. But most people, and that's the reason the medication is so limited, is because the medication takes the sugar down. So you have to be really careful as to the amount of the medication you've taken.
We need a way of creating a carrot and a stick that would make a person want to do these, and that they can see some benefit from them, for their family, and for their community.
Emphasize the importance of diet and having options available to folks here, just in terms of being able to make healthy food choices.
We go into the store and got that one medicine. when we got this big C.A.R.E. We didn't run to the doctor every time. We didn't know. I didn't know what the doctor was hardly. Folks had this old remedy, home remedy, and you wasn't sick neither.
You young people, we need to start with you all, talking to you all, and when we see you going off wrong, eating too much or whatever, we need to tell you, baby, watch what you're eating, because you are what you eat.
You ate whatever they put on that plate for you to eat. You ate it. Peas, cornbread, green, beans. You ate it. Because that's what they had. We didn't have all this modern stuff like you got now.
Getting our people educated is probably the #1 thing, since we are the #1 county in the Mississippi Delta with the least amount of education.
This short film is an amazing documentary by young people of Charleston, Mississippi. In only 5 days, they worked as a team of researchers, writers, technicians, and reporters to present only a fraction of the informative, logical, and interesting facts they learned about the health crisis of diabetes. The good news is that they discovered there is hope for the victims of diabetes. I'm Roger Bethel, and thank you for watching.